Hello, I'm Susan Weinstein, Co-Executive Director at Families for Depression Awareness. Welcome to Isn't That Covered? What Caregivers Need to Know About Mental Health and Insurance. We appreciate you joining us for this webinar. In this webinar, we're providing answers to the questions, what do families need to know about getting insurance? And how can we make the most of our insurance so it pays for the mental health care our loved ones need? We want you to have the information you need to be confident in navigating our patchwork health insurance system, both in choosing a plan that fits your family and following through when the insurance company denies or limits access to a provider, a service, or a medication. This webinar is another way that Families for Depression Awareness is working to help you provide constructive support to your loved one with regard to their mental health and well-being. At the end of the webinar, we hope you feel positioned to support your loved ones in making insurance decisions that are informed and enable them to access the care, providers, and services they need to help them get and stay well. Over the course of the webinar, you'll hear from other people as well. Becky, who's a caregiver to her husband Joe, Hannah Fergand from Healthcare for All, and Wells Wilkinson from Health Law Advocates. We appreciate all of you participating. We believe that you will learn from this webinar regardless of when you watch it. However, we encourage you to first watch our insurance clips on YouTube, which you'll find on our YouTube channel FFDA1. We also suggest that you download and refer to the insurance fact sheet that goes with this webinar in case you want to look up a definition. This can't be a webinar about every aspect of insurance, so we're focusing on equipping you, the caregiver, to be a confident decision maker and informed advocate for your loved one's mental health care. We've broken this down into 5 aspects of what's involved. Understanding your role. What insurance essentials do you need to know? How to utilize the marketplace and choose insurance in other circumstances, such as through your employer. How to appeal and exercise your health insurance rights, and the importance of taking care of yourself. These are not a linear process, but different areas that all play into helping you take on the challenges of health insurance. I do want to note that because Families for Depression Awareness is a national organization, this is a national webinar. We're not going to address the insurance variations from state to state, but we will provide information that can be applied in any state, and we'll be discussing questions to ask, things to look for, and strategies for appealing insurance decisions. These will be generally applicable regardless of where you live. Advocacy for better health care is incredibly important. More than 1 million Americans have lost health coverage since 2016. However, advocacy is not the topic for this webinar. If you're someone who is passionate about healthcare reform and you want to get involved in advocacy about cost, quality, and accessibility of care, we urge you to connect with any of the organizations listed here or find one in your state to help move the needle on Medicaid expansion and access to affordable, high-quality care. And if you watch any news, you'll know that health insurance is changing, but we don't know exactly what the changes will be, and we don't know when they'll happen. So we encourage you to stay up to date on changes. One thing you might do is sign up for newsletters to keep up with developments in insurance and healthcare. These are a few reputable sources you might consider. We're releasing this webinar to coincide with the federal open enrollment period. It's the time that you can renew or choose a different health plan through the marketplace. Here, we're showing the 2020 insurance dates, but this information is applicable for any time you need to choose an insurance plan or exercise your appeal rights. If you're purchasing a 2020 health plan through the federal health insurance marketplace, open enrollment has a short window beginning on Friday, November 1st, 2019, and ending on Sunday, December 15th, 2019. If you're watching this webinar in a later year, assuming the marketplaces are still in operation, you'll want to visit healthcare.gov to get the accurate dates for your current year. If you get your health insurance through your spouse's employer or your own employer, there will be an open enrollment period, though probably not at the same time as federal open enrollment. Whenever your open enrollment period, it's the time to reassess how effective, expensive, and appropriate your coverage has been the previous year. whether any health conditions or healthcare providers have changed, and whether your financial situation has changed. Are your healthcare priorities the same for your family? There are only a few exceptions to getting insurance during open enrollment through the marketplace. If you're of low income and qualify for Medicaid, the open enrollment restriction does not apply to you. You can enroll at any time during the year. Also, if you experience a change in your household status, lose your health insurance, or move away from your current home, you may qualify for a special enrollment period. Otherwise, you need to make your decision in the open enrollment period. We know that navigating health insurance is difficult. There are different states that have different requirements and different insurers with different plans. Even plans provided by a single company may differ in more than cost. They may have different provider networks too. As you likely know, the issues we're talking about in this webinar have a real effect on the health and well-being of individuals and families. I'm going to bring on Becky, who is caregiver to her husband, Joe. Let's hear some of their story.
Our story goes like this. My husband and I had been married for almost 15 years, together for 23 years, had a pretty normal life. Due to a hereditary condition that causes blindness, my husband had been dealing with progressive vision loss since before we were married. But we had always managed, and life really was good. In 2011, though, over a period of a week or so, I noticed he was speaking really fast and that he would try to explain things to me, but he couldn't seem to get to the point. And this was really different behavior for him, but I didn't think too much of it, honestly, because I guess I can't be the only one who sometimes only half listens to a spouse, and I wasn't that concerned. But then his talk became increasingly paranoid to the point where sometimes I thought he was joking, but sadly, he wasn't joking. He woke up early one morning during that time, and I shouldn't even say he woke up because honestly, he hadn't slept for 3 nights. He had had bronchitis. I didn't think it was odd that he wasn't sleeping because he was sick. But anyway, he woke up and I was getting ready for work and he became extremely agitated and delusional. He began screaming and making threats. And he had always been a really even-tempered person, a really kind person, never ever raising his voice. So I knew something was really wrong. I grabbed our dog, I left the house, I got the police, and then he was taken in an ambulance by force to the local hospital. When I called later that morning to check on him, so it happened at 5:30 in the morning when he was taken, and I called the hospital at 10 in the morning after my parents and a bunch of people came to my home to help me out. But the hospital told me he was ready to be released and that I needed to come and get him. And I just couldn't believe that they were going to release him to me without talking to me and without talking to the police about what had happened that morning. I was really scared. He also at that time, Joe, left a message for me and his voice was just so odd. You know, he said, "I'm ready to come home, come get me," but I knew he wasn't right. And I was really scared, but I didn't think I had a choice, so I drove to the hospital to pick him up. But my presence there sent him into an episode of psychosis that was really extreme, and it got him officially admitted. His brain was completely broken, and he thought he was protecting me, but I left that visit with bruises on me, and it was absolutely devastating. It was a really high price to pay for me personally, but it got him admitted. This was the first of what would be 4 hospitalizations that year, and the first few were for delusion and psychosis. He had lost all touch with reality. He thought people that were there to help him were really there to hurt him. It was so, so sad. And this is when I learned that insurance companies generally limit hospital stays to 3 days and then reevaluate. So for the next few weeks, he was evaluated and kept. But then the day before Thanksgiving, though he was still very delusional, this hospital chose to release him. I still hadn't been alone in a room with him since that first event, and I refused to pick him up, so they sent him to his sister's house. At her house, his behavior continued to be very bizarre, and when he showed up for his day program at a different hospital 2 days later, they admitted him right away. The provider asked me, why was he released from that other hospital? We can't, in good conscience, release him right now. So they admitted him. They did this before insurance even gave approval. They took him in, and he was eventually released from there with much clearer thoughts. And this was a great example of a hospital that cared well for him, that had his best interests in mind before even considering payment. And insurance did end up paying for that stay, but I'll never forget that they took him before knowing that. Once his thoughts cleared, he fell into a really deep long-term depression. He was hospitalized twice for that. And though his last hospitalization was a year after the episode that got him taken from our home, his depression lasted for another 3 years after that. So he got out of the hospital and he spent after the fourth hospitalization, and then he spent another 3 years in extreme depression. And it was a long journey.
Thank you, Becky. It does seem like there were highs and lows along the way, but that you did meet caring people who were able to help. And that is one caregiver's story, but let's look at the role of the caregiver more broadly. The role of the caregiver can be summarized as this: to fill in where our loved ones need help. When a person is dealing with a mood disorder, it is likely having certain impacts on their thoughts and behaviors. For example, with depression, a person can experience cognitive impairment or issues with their thinking. It can affect areas such as reasoning, organization, attention, and memory, which we in our office refer to as ROAM, and you can check out on our website at familyaware.org/more-than-mood. A person with bipolar disorder often will have a lack of insight into their having a mental health disorder and into the impact that their behaviors are having on their families and their work. So these are impediments to accomplishing the kinds of tasks that one might ordinarily be able to accomplish. So considering your loved one's functionality at this time when decisions need to be made, whether it's in choosing a plan or making an appeal, what can you realistically expect? Then you look at that and you say, well, how can I help? You will know the kinds of things that actually need to get done, and then you can work with your loved one to ensure that they do get done. Another thing to do is to prepare yourself for the long haul. It might be that their mood disorder is episodic, so that this is something that will last a certain period and then not be an issue for a while and then come again. And it may be that their mental health issue is something that is treated and then well maintained. So just know that all the things that you're doing now are really important, and there may come a time that you need to do them again. Another thing that's important to have reasonable expectations about is what kinds of financial demands are going to be made. Your loved one may need financial support. And here, for example, if we're talking about someone who has an adult child who has a mood disorder, it may be that they have trouble finding or keeping a job, and it may be that they have cash flow issues. But think about what kind of support your loved one might need, and also what kind of support you're willing to give, and then how can you prepare for that? Let's hear a little bit more from Becky on some of the challenges that she faced as a caregiver.
When I think of costs, I think treatment is really expensive and costly. And I'm a really organized person by nature, but trying to track the expenses that were piling up for his multiple hospitalizations and day programs and providers was really overwhelming. He wasn't working at all, which that seems like a funny statement. He wasn't functioning at all. He wasn't getting off the couch, so he certainly wasn't working. And meanwhile, bills were piling up. Ambulance bills weren't covered. Co-pays weren't covered. One of his medicines cost $50 a month, and he was on multiple medications at that time. The psychiatrist we decided on doesn't take our insurance, so we pay out of pocket. And it was really disheartening at times, but it was also life or death. And, what's money for if it's not to spend it up trying to save the lives of those we love? So costly, but worth it, yes.
Thank you, Becky. Here are some concrete ways that you might be called upon to help your loved ones. You might need to fill out forms or research a health plan. You might need to make calls and make appointments. You might need to help them get to appointments. You may need to manage finances in a way that you didn't before. You may also need to gather information for appeals and make sure that you're meeting deadlines. But also remember that you can set limits. These are important issues to be sure, but you may not be able to get it all done. And that is where you having a support network is extremely helpful. Maybe someone can take care of the kids while you put together the paperwork, or maybe someone else can drive your loved one to an appointment so that you pay bills. Whatever the circumstances may be, just know you're not alone. And you also need to make sure that you are taking steps to protect your own wellness